Acute stress disorder, also known as ASD, this is a psychological reaction to a traumatic event, leading to symptoms similar to PTSD but occurring shortly after the event. Agoraphobia. Agoraphobia is the intense fear of situations where escape might be difficult or help unavailable, often leading to avoidance of such situations. Alcohol and substance abuse. This involves the harmful or hazardous use of psychoactive substances, including alcohol and illicit drugs, often leading to dependence. Amnesia. Amnesia involves the partial or complete loss of memory, typically due to trauma or severe psychological stress. Anorexia. An eating disorder characterized by an intense fear of gaining weight and a distorted body image, leading to severe food restriction and weight loss. Antisocial personality disorder. Known also as sociopathy, it involves a pervasive disregard for the rights of others, impulsivity, deceitfulness, and a lack of remorse. Attention deficit, hyperactivity disorder, a neurodevelopmental disorder marked by persistent inattention, hyperactivity, and impulsivity that interfere with functioning or development. Avoidant personality disorder. This disorder is characterized by social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation, leading to avoidance of social interactions. Bibliomania. This is an obsessive-compulsive disorder involving the collection and possession of books, often to the detriment of other aspects of life. Binge eating disorder, characterized by frequent episodes of eating large quantities of food quickly and to the point of discomfort, often accompanied by feelings of loss of control. Bipolar disorder, also known as manic depressive illness, this disorder involves extreme mood swings, including emotional highs, mania, and lows, depression. Body dysmorphic disorder. Individuals with this disorder are excessively concerned about perceived flaws in their appearance, which are often minor or imagined. Borderline personality disorder, characterized by instability in moods, self-image, and personal relationships, along with impulsive behavior. Bruxism. Bruxism is the habitual grinding or clenching of teeth, often during sleep, which can cause dental damage and jaw pain. Bulimia, an eating disorder involving episodes of binge eating followed by compensatory behaviors such as vomiting, fasting, or excessive exercise. Conduct disorder, a childhood or adolescent disorder characterized by persistent patterns of behavior that violate societal norms and the rights of others, such as aggression, destruction, or deceit. Conversion disorder. This condition involves neurological symptoms, like paralysis or blindness, that are not explained by medical conditions but are linked to psychological factors. Dependent personality disorder, marked by a pervasive need to be taken care of, leading to submissive and clinging behaviors and fear of separation. Depersonalization disorder, involves persistent or recurrent feelings of detachment from one's own mental processes or body, often described as an out-of-body experience. Depressive personality disorder, a condition where individuals often feel sad, lonely, inadequate, and guilty, reacting strongly to loss or rejection with intense feelings of emptiness. Dissociative fugue, involves sudden, unplanned travel away from home or work, along with an inability to recall one's past and confusion about personal identity. Dissociative identity disorder. Previously known as multiple personality disorder, it involves the presence of two or more distinct identities or personality states within a single individual. Down syndrome, a genetic disorder caused by an extra chromosome 21, leading to developmental and intellectual delays. Dyslexia, a common learning difficulty affecting the ability to read and spell correctly, despite normal intelligence and educational opportunities. Dyspraxia. Dyspraxia is a developmental disorder affecting motor coordination, making it difficult for individuals to plan and perform movements smoothly. Erotomania, a type of delusional disorder where the affected person has an unfounded belief that another individual is in love with them. Expressive language disorder. This disorder impacts the ability to express oneself verbally despite understanding others' speech. Folie à deux, a rare condition where a delusional belief is shared by two closely related individuals. Gender dysphoria, a condition where there is a strong incongruence between one's experienced or expressed gender and the gender assigned at birth. Generalized anxiety disorder. This involves excessive, uncontrollable worry about various aspects of daily life, often accompanied by physical symptoms like restlessness and muscle tension. Histrionic personality disorder, characterized by a pattern of excessive emotionality and attention-seeking behavior. Hypochondriasis, now referred to as illness anxiety disorder, it involves an excessive preoccupation with having a serious illness, despite medical reassurance. Kleptomania, the recurrent inability to resist urges to steal items that are not needed for personal use or monetary gain. Munchausen syndrome. This involves fabricating or exaggerating physical or psychological symptoms to assume the role of a patient. Narcissistic personality disorder. This disorder is marked by an inflated sense of self-importance, a constant need for admiration, and a lack of empathy for others. Obsessive compulsive disorder. OCD is characterized by persistent, unwanted thoughts, obsessions, and repetitive behaviors, compulsions, performed to alleviate the anxiety caused by these thoughts. Onychophagia, the compulsive habit of biting one's nails, often resulting in tissue damage and potential infections. Pica, a disorder characterized by the persistent consumption of non-nutritive, non-food substances inappropriate to the developmental level of the individual. Post-traumatic stress disorder. PTSD occurs after experiencing or witnessing a traumatic event, leading to symptoms like flashbacks, nightmares, severe anxiety, and intrusive memories. Primary insomnia. Difficulty initiating or maintaining sleep that is not attributable to any other medical or psychological condition. Primary hypersomnia. Excessive daytime sleepiness without a clear cause, leading to prolonged and unrefreshing sleep. Scopophobia. Scopophobia is the extreme fear of being looked at, which can lead to significant anxiety and avoidance of social interactions. Sleepwalking disorder involves engaging in complex behaviors while partially aroused from sleep, often without any memory of the event. Social anxiety disorder, a condition where individuals experience intense fear and avoidance of social situations due to concerns about being judged or embarrassed. Tic disorders. These involve sudden, involuntary movements or sounds, such as those seen in Tourette syndrome, that can interfere with daily activities. Hit the like button if you've learned something from this video. If you want more content like this, subscribe and comment on what other topics you want us to explain in minutes.